I think to understand Cuba, you've got to be able to hold two contradictory ideas or even realities in your head at the same time. So I think, for example, in regards to the healthcare system, while I would say that the quality of the education and healthcare that's always celebrated in Cuba is much overhyped, it is a real accomplishment of the country over the last 60 years to have prioritized those things and produced 2 or 3 generations of professionals who they can export to the world and actually do quality health, provide quality health care, right? But of course, that is been achieved at a very high cost in terms of just human freedom, but also their own private sector has been destroyed or collapsed. So you can have great doctors, but you might have to send those doctors abroad, or those doctors might leave the country because they can't make a living working as a doctor. So, when you kind of nationalize your economy and you kick out all the foreign supposed exploiters, right? Then you have to produce everything yourself, right? And maybe you can't produce the medical equipment or the medicine, right? This is in addition to the very real impact of the embargo. The U.S. embargo on Cuba makes it more difficult or illegal for Cuba to buy and sell things from the United States, right? They can buy food and medicine from the United States, even with the embargo, but it's very difficult to do that because there's a lot of other, let's say, red tape around those transactions. And the embargo also has what we might call extraterritorial provisions. Basically, the embargo doesn't just prevent trade between the U.S. and Cuba, but it also sanctions and punishes third countries and third parties that do business with Cuba if they want to still do business with the U.S. So it has the embargo of Cuba is a unique in all the world in terms of our sanctions regimes, because it has that other layer that punishes third countries and third parties. With that said, the reality that the controls have produced in Cuba have ended up fracturing the society into a real unequal society with haves and have-nots. Those people who are connected to the party or to the military might have much better access to medicines and quality health care.
Or Advil.
Or you might have a bizarre situation where, there's a hospital and it's free and the doctors are really good, but you have to bring your own lunch, you have to bring your own sheets, you have to bring your own medicines, and you can't always get those things easily. So it is kind of dual surreal reality where you have a great doctor but no medicine, right?
Yeah, that's a tough one to get by. It's unbelievable.